Thank you everyone for making time again this Friday. This is an important week from an update point of view because there have been certain updates since last week. So this is a good time for us to catch, to to get together and catch up on those updates that have come out this week. Um, as usual, the very capable Dr. Amit Kumar is my co-presenter, and he is going to run us through some of the key developments that have happened over the last 1 week. Also, some no developments that have continued where status quo is being maintained insofar as regulations, etc., is concerned. And I hope that the next 40 odd minutes are useful. We'll be also very happy to take questions from you towards the end of the session. If we have those answers, we'll go out and give them out to you. And if we don't, then we'll try and get those answers back to you as soon as possible. So without further ado, I think, Dr. Amit, we could get started.
Thank you, Aris, for such a nice introduction. So, very good evening to all participants. So, first, we will start from beneficiary eligibility. So, who all can take benefit of the vaccination drive. So, as you all know that all healthcare workers, frontline workers, people who have 45 years of age with comorbidities and till 59 years of age, they can apply with comorbidity form. And the people age above 60 years, they can also have this vaccination. So these are specifically three groups till 31st March we have. And from 1st April onwards, government is allowing above 45 years of age without any comorbidities people to take these vaccinations. So this is the beneficiary eligibility criteria. So what the people who is having comorbidities, so what all comorbidities are there? So there are 20 such comorbidities which is listed by Ministry of Health and Family Welfare. So these are like heart failure, post cardiac transplant, moderate to severe heart disease, congenital heart disease, hypertension, diabetes, so on, so forth. So these are 20, such comorbidities in which we require a registered medical, certification, after which, one can get the vaccination. So this is the form which people who is having comorbidities have to fill, and this certificate would be given by registered medical practitioner only, and you have to provide all true information about your disease. So any false information, as you know, is an offense. So we have to provide all the relevant and true information in this form. Otherwise there will be lot of side effects one can face after vaccination. So true information is very much important, and that will help that inoculation center also. So we have, for COVID vaccinations, we have vaccination centers, which is we have some government vaccination centers like all impaneled hospitals under Pradhan Mantri Jan Arogya Yojana, and under CGHS also we have hospitals, we have private hospitals, we have some health clinics, wellness centers are there where we are inoculating patients, and even primary health centers, eye hospitals. We are using ESI centers for vaccination, where they are maintaining a proper cold chain. They have proper space and rooms where they are doing this complete vaccination process. For registration and appointment, so what we have to do for registration and appointment, so you can log in into CoWIN portal using the link www.cowin.gov.in, and you have to click on register, and you have to register yourself for COVID-19 vaccination. There is no authorized mobile app for registering for vaccination in India. So you need to go log in into COVID portal, and you can also register for vaccination through Arogya Setu app. You can register COVID portal by using your ID proofs like Aadhaar card, driving license, PAN card, passport, your voter ID card. So these are the documents required for registration. From the same number, you four people can register through the same mobile number. Means the person who is having mobile number, and beyond that, three-person can also use the same mobile number. So you can search in COVID portal Arogya Setu for the vaccination centers nearest you, locating. You have to put pin code there, and you have to choose state and districts through which you can get the nearest vaccination center. So at present, as you all know, that about 60 years of age and between 45 with comorbidities up to 59 years, uh, uh, eligible candidates can register themselves. So the appointment can be rescheduled anytime. In case you do not go for vaccination on the date of appointment, you can reschedule the appointment by clicking on reschedule tab. Once appointment is scheduled, you will receive the details of vaccination centers, date, time, slot, and appointment on SMS also on your registered mobile number. And you can download the appointment slip also and take a printout on the vaccination for the vaccination day. And vaccination centers also provide, for a limited numbers of on-spot registrations slots every day. So as you know, now 24/7 uh, vaccination drive is on. So similarly, you can, after your vaccination, you can download the vaccination certificate also through the same center. You have to just request to the center person that just provide the vaccination certificate. So they will provide you vaccination certificate also without charging anything. In that vaccination 250 rupees, the fees is include for vaccination certificate also, so you need not to pay anything beyond that. Similarly, all these details, as I told you, that for second dose also you can again register on COVID, and you have to reschedule your appointments if you want that vaccine for second dose. You are not in the same city and you want to change your district, your city, and the timings, you can change. So accordingly, your previous appointment will be omitted automatically, and the new appointment you will get through SMS through that particular vaccination centers. Choice of vaccine is not there. There is no drop down in Covin app where you can choose vaccine brand like Covaxin and Covishield. There are two brands, so you can't choose that. So the vaccine which is available on that center will be given to everybody on the same day. So pricing for vaccines, we have in government centers, that is free of cost. They are not charging anything for vaccine and for the certificates. For private health facilities, they are charging 250 rupees. In the bifurcation of this 250 rupees, there is 150 rupees is vaccine cost and 100 rupees is operational charges. So that comes to 250 rupees. And now we have some news about the doses modification also. As you all heard that there are some blood clot cases and all that in some European countries some time back. So after checking all the parameters, now government reached to the conclusion, and they had enhanced the Covishield vaccine timings. So before that, after 28 days, we are getting the second dose. For now, it is reached after first dose. There should be a gap of 6 to 8 weeks. in Covishield, and in Covaxin, it is 4 to 6 weeks. So this is the new development in dose modification. So for open questions, it's over to you, Aris.
Thank you, Dr. Amit. So I think to summarize in all, what hasn't changed is the registration modality. What hasn't changed is the two vaccine candidates. We continue to have two vaccine candidates. The registration modality remains same, unchanged. Um, what has really changed are two broad issues. One, of course, is a notification, which is applicable only to Serum Institute AstraZeneca's Covishield vaccine, where the government has recommended that the interval between the two doses needs to increase from earlier 28 days to anywhere time between 6 weeks to 8 weeks. Largely, this is on account of recent clinical studies that have pointed to the fact that the vaccine efficacy of AstraZeneca's Covishield increases if the dose interval between the two doses is increased up to 8 weeks. And keeping that in mind, the ICMR and the Ministry of Health have decided to issue this advisory. Now, it still remains to be seen how does this impact the population group that has already undergone the first dose of Covishield. Some of the cases which have come to our light is that the adherence to this advisory is mixed because there are cases where beneficiaries who have gotten their first dose done on a certain date are still being able to get their second doses at least scheduled between within the before 6 to 8 weeks at 28 days interval as well. But I guess that moving forward, as more and more people get inoculated with their first doses, this advisory will be followed more rigorously. So I think that is one thing that we need to keep in mind. The other big elephant in the room is, of course, the fact that government has now gone ahead and said that effective 1st of April, all citizens, irrespective of their disease status, their disease risks or predisposition, uh, their social standing, their professional work environment, irrespective of that, all citizens above 45 will be able to go ahead and get themselves vaccinated. Of course, population groups in which the vaccine is contraindicated, of course, continues to stay away. But everyone else above 45 years is going to be eligible for vaccination. So how does this impact you? Of course, clearly the target audience that was so far till the 1st of April limited to only 60 years and above and 45 years if comorbidity was present, was a very small target audience. I think now the target audience, even within your own respective organizations, would increase substantially because of this, this phase 3 rollout. Now, obviously, the open question is that what is the role of aggregators? What are the other organizations doing? I alluded to the fact that last week we had done a quick dip survey among 60 odd organizations representing all sectors of corporates, both manufacturing, IT, banking and financial, etc. And overwhelmingly, almost 70%, above 70% of organizations have decided that they will take on the cost of vaccination for employees, in some cases employees and dependents, and in some cases employees, dependents, and immediate extended family, parents or parents-in-law. So that's what organizations have clearly decided that they are going to be doing. About 15% of organizations were still undecided, but we very strongly believe that they will also move towards uh, ensuring that they pay for vaccines as well. The second question is about the modality of the payment. How is that happening? Now, there it's a mixed bag. Um, a number of large organizations are still evaluating and running numbers around what is perhaps the most efficient way of uh, getting to fund vaccines. Is the insurance route a good route, or perhaps allow the employees to stick to the prescribed government open to public process and then reimbursing the employees through payrolls, etc. Some organizations are also figuring out if they can get into direct understanding and tie-ups with hospitals and some of these vaccination centers into a sort of a pay on credit model where the employees could go get vaccinated at no cost. They don't have to pay anything, and the vaccination center or hospital raises an invoice to the organization on a predefined frequency. Now, there is no magic bullet and there is no right answer for all. A, whatever approach organizations are taking or would take would depend on the unique situation and the unique demographic requirement of their organization and their employees. So therefore, it is important that you go back and understand, and we at Anviti could help you understand what would be the best way forward that works for your organization in terms of the modality that you would approach in trying to facilitate, if you are indeed trying to facilitate COVID vaccination for your employees. Um, so that's one important thing. The other questions that we've kept open here are price capping, etc. Those relatively remain unchanged. So the government pricing of 250 rupees for paid vaccination continues unchanged, even with the phase 3 being rolled out. There is no change in the pricing there, or at least it hasn't been announced if there is any. So we are assuming that it is 250 rupees that continues to be there even for the expanded coverage now, effective 1st of April. There is, of course, a lot of noise in the market with regards to service providers. A number of them have come up with different models. The most popular being the concierge model of trying to facilitate vaccination for a small fee, and that fee is basically varying from a few rupees to a few hundred rupees, depending on the brand of the hospital and the services they are providing, etc. So once again, it is up to the organizations to really figure out whether it makes sense to um, get into or utilize this service, because there are obviously 25 to 40%, in some cases even 100% cost impact with relation to the cost of the vaccine there. So that's something that we have to evaluate. Going forward, I mean, what is our advice for organizations? And that continues unchanged even today. Uh, Most important is that, perhaps this is the time that you should have thought through your strategy for your organization and perhaps communicated that clearly to the employees as well. And if you haven't done that already, please start doing that, because your employees would now perhaps start coming back to you because they would have heard by now in the media about what other organizations are doing, and they would want to know, what their own organization is doing with regards to that. So perhaps by now you could have, or you would have crystallized your thoughts. Perhaps it's time to put your communication plan in place to let employees know how you are going to be facilitating this entire endeavor and what is your advice for them. I think it will also be a good time now to start thinking about what are going to be the adoption rates of vaccine within your own organization, because like we highlighted last week as well, vaccine hesitancy is a big problem, is a big issue. It is not being discussed enough, but it has an impact on your overall return to work strategy. And therefore, if you have significant amount of vaccinated versus non-vaccinated population, then how is your entire logistical asset, asset base being reconfigured to handle that particular issue? An important thing to point out here right now is that there are a number of healthcare providers who have actually gone out, and they may have reached out to some of you as well, who are actually promising on-site vaccination for some organizations. At least we have come across one service provider who is committed to doing on-site vaccinations in the NCR region. So on closer scrutiny and due diligence, we realized that in the state of Haryana specifically, the state government has allowed certain hospitals to use their mobile and community outreach asset to go out and cover certain resident welfare associations under vaccination. So some hospitals have been given that permission only by the government of Haryana, which happens to be one of the states among many states in India. But the rationale behind that is to cover larger population in resident welfare associations. However, some hospitals are using this loophole to basically beginning to conduct vaccination camps in large organizations. But even those service conditions come with a number of caveats in terms of minimum doses that the company needs to guarantee per day. And I think that's 1,000. Obviously, the service is only available in the state of Haryana, which means Gurgaon or Faridabad, for that matter. If any of your organizations have businesses there or offices there. And the other caveat is that nothing less than 1,000 vaccines per day. Now, while this has been going on, and I think at least 2 organizations in public sector have utilized these camps, we are not sure of the legality of this particular initiative. Therefore, we would like to caution our organizations and our clients about being aware of potential legal issues that they may find themselves in unwittingly because of participating in this initiative. So that's one word of caution. If some proposals do come across, please feel free to share them with us. We will go ahead and do those due diligences on your behalf and advise you on the right way or the right way forward. But please do not, blindly look at proposals being shared by you by different agencies and take them on face value. Because as your brokers, as your consultants, it is our job to ensure that you are in compliance from a regulatory standpoint as well, and that there are no potential legal challenges that you end up facing on account of lack of due diligence there. So that's something that I wanted to highlight, especially this week. Of course, going forward, we will continue to, as much as possible, keep you updated on any regulatory changes that are happening. We have found that our weekly client briefing update, such as this, is really helping a lot of clients to keep abreast with things that are changing, at a lightning pace. So therefore, you know, we are seeing great number of participations, follow-up questions, etc. And I think this is a step in the right direction. So please do take time out and attend, our client briefing sessions. It is one-stop shop where you would get answers to most of your questions. And of course, your individual requirement, you're more than happy to reach out to your individual client relationship managers. You could reach out to us at our health risk management team, and we'll be happy to work you through that. And of course, I reiterated that last week as well, the Beyond Vaccination Action Plan, because, right, I mean, this year we will go ahead with the flow as things come. But we really need to be thinking now long term. What about the cost of vaccination? Because this is going to be sticking with us for the next few years, if not decades. How do we now budget for the cost of vaccinations? How do we integrate this in our long-term benefit plans? What would be the impact overall in year 2, year 3, year 4? So these are some open questions that are long-term in nature, but yes, I mean, perhaps this is the right time to start thinking about it. And these conversations, are good to have now. We'll be happy to partner with these conversations. As you are aware, we have a very capable, benefits team. We are keeping a track of all regulatory updates as and when they happen. Unfortunately, as much as we would like to do more, we also rely on information that is out there released by the government. But we ensure that all the information that we pick out for you come from credible sources, and could be relied upon. So that's essentially, something that we wanted to share with you. And if there are any questions, I think this is a good time to take them. I don't think we have any questions so far, but we'll still wait, see if there are any. Yes, I think we just had a question on organized. Are there any hospitals that are opening vaccinations for corporates on certain days? The answer is yes. Yes, of course, there are organizations who are doing that. There are hospitals who are doing that as well. In fact, just today, we helped one of our clients tie up for this with one of the hospitals in Pune. So yes, it is possible. It can be done. The process is fairly straightforward. First, obviously, we'll have to figure out what are the geographies that we're talking about. In this case, it was only one geography of Pune. And then what we would do is try and understand which are the hospitals in the vicinity or in the same city who would be open to such a tie-up. We bring both you and the hospital together.
When can we expect the vaccination for all ages? So I think not before July and August. So we are also not sure.
Yes,
It's
I mean,
totally depend of Ministry of Health and Family Welfare and government what they will decide for all
absolutely,
ages. Yeah.
absolutely, absolutely. I mean, in fact, I would go as far as ahead and not even commit a month to you, because it could happen tomorrow or it can happen after a month. We don't know. It is only after the government announces, or in this case, the minister announced during a press brief that the vaccination will now cover 45 years and above. There is no formal notification as such. We tried looking at a formal press release or a government order, but there isn't any. So right now, even the 1st of April vaccination, we are only relying upon the public statement made to press by the Honorable Union Minister, and so that's where we are. But it's very difficult to actually predict when the government would open to everybody. And if we were to give you even any indication of month, it would be only an assumption and speculation at best.
So I'm not able to see any question in chat box and QA box further.
Yes. Well, if there are no questions, then I think we will give back 15 minutes to you. It's a Friday, and we know that all of you have busy calendars. So, having said that, even if you have any other question, you could send that to us um, at our email IDs, and we'll be happy to address them. If you don't have our email IDs, you could reach out to your CRMs and request them to forward this to us at the Health Risk Management team, and we'll be happy to get you answers to your questions as well. We have a question. There is no answer. There is no right answer to this question. Both the vaccines are equally efficient. Both the vaccines have gone ahead and gone through their due diligence in terms of clinical trials. And both the vaccines have been approved by the regulators, not just in India, but in other parts of the world also to be used. So therefore, I think both the vaccines are equally good. We can't comment on one over the other. Idea is to get vaccinated, whichever vaccine is available, because both are equally good. And just a note, I mean, because of media, we get to know a lot of numbers: 75% efficacy, 85% efficacy, 71% efficacy. Yeah, these are largely academic numbers. What you need to really take comfort in the fact is that vaccines go a long way in preventing these COVID infections. And therefore, the benefits of taking vaccines far outweigh not taking a vaccine. So therefore, take any that is available to you. Just make sure that your second dose is the same as the first one.
And adding to the same question, so there is no as such booster dose is available or recommended by government yet. So if ultimately these are two doses are there as of now, and in future if there is any booster dose, we will update you for that also.
In fact, technically speaking, the second dose that you're getting for a vaccine is a booster dose. So beyond this, yeah, if the vaccine regimen says 2 doses, take 2 doses. If it says take 1 dose, take 1 dose. We'll call it a day then. And please, all of you, have a safe and a wonderful weekend. And we'll catch up again next Friday, same time, same day, for any updates, any changes. And if there are none, we'll quickly breeze through this again. Thank you so much.